The Department of Health has urged the public to vaccinate against COVID-19 as it is still upon us. The department says it had also been notified by the National Institute for Communicable Diseases of the increasing circulation of influenza around the country since the beginning of May 2023. The cases have been steadily increasing, and the NICD has received reports of influenza clusters in schools and workplaces alike. So to take this discussion further, we're joined via Zoom by Dr Fundile Nyati, Chief Executive of Proactive Health Solutions. A very good afternoon to you, Dr. Nyati. Thank you for joining us here on the SABC.
Good afternoon to you and to all of the viewers.
On the issue of COVID-19, it seems that there's a great vaccine fatigue in South Africa, currently lending to the department, sitting with hundreds of unused vaccines. And I wonder, in your opinion, how this matter can be adequately addressed.
Look, the government did, procure those vaccines at great cost, and they were hoping that the majority of South Africans, at least about 70%, would be vaccinated. But we just got just below 50% of the target, that is around 50%, yet we're looking for 70%. So the vaccine stock that we have as a result of the fact that the vaccination program was not as successful as we wanted. But also, why did we not reach that number? Most of it is related to misinformation around vaccination or even disinformation around vaccination. So I would like to say vaccine fatigue, but also on the other hand, people being reluctant to take the vaccines based on the information that was available in various platforms, especially social media.
Let's get into some of the misinformation and disinformation that is pervading society at this point. I wonder if you could speak to that, some of the side effects that have emerged based on the research now that time has also passed. I wonder how important research is at this point and how we can also balance it with indigenous knowledge systems.
Yeah, well, I think what's important is that obviously COVID-19 was a new kind of disease. No one knew, about the disease prior to it coming, and it took, therefore, some time for the medical scientists to actually find ways to deal with it. And one of the ways of dealing with any disease, especially if there's no treatment, is vaccination. Now, to develop a vaccine, the shortest period prior to COVID-19 was like 4 years. But because of the advances in the technologies of doing vaccines, we were able, that is now the medical scientific community, the researchers, they were able to come up with a vaccine, at a reasonable period, which was just almost a year. But obviously that created problems for many people because they were asking them questions. They were asking questions about how can we have an effective vaccine developed in such a short period of time? And that's where most of the misinformation then came from, that these are basically half-baked type of vaccines that are likely to cause problems in terms of the DNA of the people and many other things that, there will be some microchips that will be inserted on people and all of that. So that information scared a lot of people and led to a number of people actually being, firm anti-vaxxers. And others, they did that reluctantly. So that is the key issue. And unfortunately, I think on the side of the Department of Health and medical professionals like myself, we didn't raise our voices and clear those, cases of disinformation or misinformation. And so we had a relatively lower vaccination rate than we had wanted. Now, any pharmaceutical product, be it a tablet, capsule, or an injection, there will be some side effects. But when those are actually given, we look at the benefits versus the side effects. So both vaccines that were used here in South Africa, the Pfizer and also the J&J, based on the studies done, phase 1, phase 2, phase 3 that were done, yes, in a short period of time, they showed more benefit than the side effects. So we know that in South Africa, so far, I think we've just heard about 2 people who died based on side effects relating to the J&J vaccine. But we have not recorded any death, that is this SABRA, relating to the Pfizer vaccine. So for that reason, it is important that, there is continued, research on how these vaccines behaved or how people reacted to the vaccines when, it was rolled out. And that's the job of South African Health Products Regulatory Authority to be able to do that. But so far, only 2.
Let me just interject, for interest of time. I want to look at the flu season. It's now upon us. It's winter. Can you talk to the importance of the flu vaccine, perhaps also some of the other vaccines available, including mumps, measles, diphtheria? I just want to also look at how, it's obviously going to impact the healthcare system at large as well.
Yeah, well, we are in the southern hemisphere of South Africa, and so our winter season is at this point, from around May until July, that's our flu season in South Africa. So at this moment, we are starting to see a lot of people who have got, severe flu. And in some instances, yes, some people do get, secondary infections where they have to go to hospital. A number of people have been struggling to, recover from the flu. But listening to somebody from NICD, they are still trying to look at, could it be something to do with the strain, why this seems to be quite strong. So what's important is that those people are high risk, people with heart problems, people with lung problems, people who are elderly and the young should really get a vaccine so that if they get the infection, it becomes mild and therefore not life-threatening. However, we also have a problem in South Africa. Since last year, October, we've got a measles outbreak for children. And early this year, a few months ago, we have a problem of diphtheria. And also, so we need to make sure that the young get vaccinated because the vaccination programs were affected by the COVID-19 pandemic. And so now we are reaping, the downside of not vaccinating people properly during the pandemic. So those are the problems. So people must not just worry about COVID-19. High-risk people for COVID-19, high-risk people for flu, kids who didn't do their proper vaccination, we need to make sure that those vaccines are taken, because if you get infected when you have taken a vaccine, it will always be, milder than if you did not take a vaccine.
Dr. Fundile Nyati, thank you very much for joining us here on the SABC. Again, Chief Executive Proactive Health Solutions, Dr. Fundile Nyati.